Welcome, welcome, welcome. It's Winning Wednesday. It's the middle of our week where we are on a journey to study a great topic to help us prepare for our nursing licensure examination called the NCLEX. So if you are trying to be a nurse, trying to pass that test, you are in the right place. Man, we're going to talk about herbal medications today. You know, this is a subject that I go over in the NCLEX V2. Is so important. We're going to get into that, but I have to remind you of some special things. I told you this month is happening. So there's some special things that I need to go over. The first one, housekeeping. We have an app now, okay? And if you already have that app, then you might be aware that it's time for you to upgrade if you don't have the V2, but that's coming. I'm going to say more about that later. Also, I want to let you know that Black Friday is coming. Black Friday is coming. And before Black Friday gets here, we have pre-Black Friday, which is so sweet. It's just as sweet. Let me tell you how sweet it is, because when you think about Black Friday, you think about getting the best deal for the Remar products ever all year. So with Black Friday coming, what we're going to do for the Remar V2, because you're going to get, if you don't have V2, you're going to get it on Black Friday. But before Black Friday, I want to position you to pay the lowest amount for the V2. So what you need to do is get ready for this weekend, because we're doing a $10 holla book sale. So that means this weekend, Friday, actually through Monday, we're going to extend it. The book Quick Facts for NCLEX, $10. And listen, not only Quick Facts for NCLEX, but another book is $10. Guess what book that is? Quick Facts for Nursing School. This is the Black Friday of somebody's dream, okay? Because a $10 Quick Facts, unheard of. A $10 nursing. I was on TikTok today. I can't get through TikTok without seeing nursing students talk about Quick Facts for NCLEX or Quick Facts for Nursing School. Have you seen it? It's like a craze going on right now. And on TikTok, that book is $20. So this weekend, if you know, the book will be $10, okay? And if you already have it, Christmas is coming. It could be a stocking stuffer to a nursing student that you love or a nurse that you love that is studying. So $10 for the Quick Facts book. Hey, we're going to be doing more. We're going to be doing more Black Friday announcements. I'm going to be releasing some new things I'm so excited about. So if you don't have the know about what's coming for Black Friday, please sign up for it. It's super easy to sign up for Black Friday. You just need to go to remarnurse.com/Black Friday. Let me see if I have that somewhere. remarnurse.com/Black Friday. It is coming. And I am super excited about this Friday. $10 for the Quick Facts book. Okay. We are getting into, I know that makes me so excited. You guys have no idea. We're getting into talking about herbal medications on today. And what I want to do is just present a scenario and see if we can discuss it. So let's go. Here's our patient Winning Wednesday. Mr. John Smith, a 58-year-old man with a history of hypertension and diabetes. Okay, those two. Recently started taking a herbal supplement called St. John's wort for mild depression, which he purchased over the counter. He did not discuss the supplement with his primary care provider. Mr. Smith arrives at the ER with symptoms of dizziness, confusion, and high blood pressure. His wife reports that he recently started feeling more anxious and his blood sugar levels have been fluctuating more than usual. So we have a patient with a history, all right, of some diseases, and he starts taking herbal medications. So nurses, how do we feel about this? Oh, here's the banner on the bottom of the screen. You can see to sign up for a Black Friday, just really quickly, go to remarnurse.com/Black Friday, and you will be informed of the Black Friday products, all of our giveaways, Last year, I think we gave away hundreds of dollars every hour. So we were able to be a huge blessing. So just sign up for it. It'll put you in the know. You'll know when we're doing game nights and all the good things that we do during Black Friday. Okay, let's get back into our patient. So our patient has a history of diseases, and he also is having a desire to use herbal medication, specifically St. John's wort. So my first question is, how might St. John's wort interact with Mr. Smith's prescribed medications for hypertension and diabetes? And this is even before I don't even have to really name a medication. Like, he's on the medication like lisinopril or metformin. I mean, how would we expect herbal medicines to interact with those medications in general, or with any medication, specifically St. John's wort? What do we know about it? What do we know about it? Good comments on the screen. We need to know. Yes, we need to know, how much is he taking? Where is he getting it from? Because he has these other symptoms now. So if a patient is taking St. John's wort, the things that you need to know about herbal medications are, what do they take them for? And then also, what other side effects can these have interacting with medications, right? So St. John's wort can interact. Let me make it big here for you. St. John's wort can interact with many medications by speeding up their metabolism in the liver. So lisinopril, if this patient, Mr. Smith, was taking lisinopril for hypertension, it may become less effective, possibly leading to higher blood pressure. So hypertension, which we would see in his elevated blood pressure reading. Metformin. If the patient was taking metformin, this also might be a reason why the patient has an uncontrolled or less controlled blood glucose level. All right. So St. John's wort can have many interactions that can also increase anxiety and cause confusion in some patients, which might be part of his issue, So let's get into herbal medications in general. Herbal medicines, they are made from parts of plants like leaves, stems, flowers, roots, and seeds. Now, they are considered dietary supplements. So that is why they can be made and sold without, a prescription, providing that they're safe or work well, unlike regular medicine. So herbal medications are considered dietary supplements. Herbal supplements are available in a variety of forms. And some of you know this because you actually are taking herbal medications yourself. List the herbal medications that you indulge in. Let us know. What are we seeing in the public? Because herbal supplements come in a variety of forms, including dried, chopped, powdered, or pills, or liquids, and can be used in a variety of techniques, including taking orally as capsules, powders, or liquids, served as a tea, absorbed into the skin as creams, lotions, or gel, and or mixed with bath water. Okay. Some common herbal products. And if you have the V2, again, you can add this information to your V2 student workbook, because herbal medications is a subject that you must study and you must review before you sit for your licensure examination. You got to know these. All right. Black cohosh is a common one. This is prescribed for menopausal symptoms, menstrual cramps, uterine spasms, and vaginitis. Feverfew, because of its pain relieving qualities, feverfew has been used to relieve migraine headaches and menstrual cramps. Evening primrose, this may be beneficial in relieving arthritis and premenstrual syndrome symptoms. And echinacea is commonly used to improve immunity and to prevent colds and flu. Yes. Okay. We also have some more. Garlic. Patients use garlic often for cardiovascular diseases, such as elevated cholesterol and triglyceride levels related to an increased risk of atherosclerosis. A, ginkgo biloba, used for various age-related conditions such as memory loss and poor circulation. Can't leave out ginseng. Actually, I had a smoothie with ginseng in it yesterday. This serves as beneficial in improving energy levels and enhancing stress resistance, as well as serving as a health supplement to promote overall body tone. And how about golden seal? Commonly used to treat colds and flu and relieve inflammation or soreness at the nose lining. So there are some herbal medications that you must know, okay? And there's more than what I presented here. So remember, when we are studying for NCLEX, what we do on YouTube as a community is supposed to be in a review or a help to the main course that you are doing. This exam is very comprehensive. And so one of the problems that I see when nursing students are just using YouTube videos to study for NCLEX, they don't have the ability to critically think well. The reason why is because when you're just using YouTube videos, you're not getting a sequence of knowledge. You're getting random subjects that you still have to create a framework for. So when I encourage you to get into the V2, I'm telling you guys, Black Friday is coming. When I'm encouraging you to get into the V2, it is so you can have that framework that the YouTube videos, the Facebook videos become a review. All right. That is the way that I want you to position this process. I got a TikTok message from a student today that said, I failed. I said, I'm sorry to hear that. Why did you fail? They said, because I was part of a Facebook group and they were selling questions, 150 questions, and I brought the questions and they were fake. Okay. So this is not the time to cut corners when you are trying to go through a process of education. Get in the V2 system so you don't have to guess what's going to be on the test. I created it for people that are like me. Just give me straight to the point what I need to do to be successful. All right. So it's real products. It's real work that's involved, but you get real results. That's all I can say. Okay. All right. So going back to where we were, these herbal medications that I reviewed tonight, all right, they are going to help you if you study them and if you apply what you are learning to real life scenarios. So it's time for NCLEX questions. Let's get into it. The first question is, when is the pre-Black Friday? Okay. When is the pre-Black Friday sale coming? Okay. And that is going to be on Friday. I'm trying to help y'all because I don't want on Tuesday somebody messaging me saying that they missed Black Friday sale. Okay. So it's coming. All right. Here's our first question. A 45-year-old male post-valve client, we're talking about herbal medications, will go home late in the afternoon. Which of the following should not be combined? Number 1, dobutamine and garlic. 2, coumadin and ginseng. 3, nitroprusside and green tea. Or 4, aminonerone and echinacea. Okay, so this is taking herbal medications and applying it to real life. This one should be easy for you if you have the foundational knowledge of it. It is absolutely number 2, coumadin and ginseng, because these two together can increase the bleeding of this patient that just had post-valve replacement. Whew, that's serious. All right, I'm moving on. Here's number 2. The nurse prepares morphine for a client who underwent below knee amputation 12 hours ago. Which of the following herbal medications is known to prolong the sedation effect of opioids? Number 1, ginkgo biloba. 2, hawthorn. 3, evening primrose. Or 4, St. John's wort. Oh, this is good. And this is why you show up to class every Wednesday. We're here to learn something new, to press our way into an amazing week. It's a great week. Okay, correct answer. Pow! 4, St. John's wort. Did you know that? Right? Based on its pharmacological properties, St. John's wort may increase opioid side effects of anesthesia, okay, prolonging the duration. I'm moving on. Question number 3 is this. The client plans to try chamomile tea to help her insomnia. Which teaching should the nurse include? Number 1, start with the smallest amount. 2, take on an empty stomach. 3, check blood sugar first. Or 4, do not combine with any medication. This is great. This is a beautifully, if I say so myself, Regina, this question, so good. Safety, 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 safety. First and best answer is the first one. Number 1, start with the smallest amount. Okay? Start with the smallest amount. If the patient's talking about trying something for insomnia, start with the smallest amount. Now, what's wrong with the other ones? Take on an empty stomach. This is not the best. This is not the best teaching, okay? Check blood sugar first. We have no indication here that the patient has any blood sugar issues. Do not combine with any medication. This is a dangerous thing to say because if the patient is going to drink it, if they're going to try it, then they may say, well, the nurse said I shouldn't use any medication, so maybe I won't take my blood pressure medicine, or maybe I won't take my insulin or whatever. Okay. So the safest thing for the nurse to do is number 1. You have to be able to see these answers. All right. Question number 4. What is this? The nurse monitors a client who started theophylline treatment based on the client's medication list. The client also takes St. John's wort to relieve depression. Which of the following assessment would imply immediate nursing action? Number 1, blood sugar level of 109. 2, temperature 98.5. 3, respiratory rate 32. Or 4, blood pressure of 139/78. Got to know pharmacology here. This is why herbal medications can be challenging, and this is why they're on the exam. The correct answer, I hope you see this one. I hope you know theophylline. It's in quick facts. Correct answer is 3, respiratory rate of 32. Okay. So patient with a respiratory rate of 32, even if you don't know theophylline is a respiratory medication, you could still see that 32 is above the normal range. We're looking for like 12 to 20, right? So you have to be able to identify fundamental vital signs. Okay. I think I have another question. Let me see. I do. The nurse attends to a client who visits the clinic for the first time. The nurse asks for the client's list of medications, including herbal supplements. What relevance does data on herbal medications have on a client's treatment? Number 1, it is safe because it's natural. 2, it can be taken with other medicine. 3, it has no allergic reaction. Or 4, it could affect other drugs' actions. What are you picking here? Come on and give it to me in the comments, everybody. It's good to see you on Wednesday. Always good to see you. Correct answer is going to be number 4. It can affect other drugs' actions. And that is the entire point about understanding herbal medications that people can get without a prescription. It is about understanding how herbal medications can change a patient's normal hemodynamic state. And more importantly, it's also about being prepared for this NCLEX and not being caught by surprises and not being caught up in scams, okay? I want you to avoid all scams this holiday season. And I want you to be able to get real products at a really good price. So what I'm positioning you for this week is to look at the whole program of V2. And on Friday, you're going to get part of the V2. You're going to get the Quick Facts book on Friday, okay, for $10. And then during the Black Friday sale, the real one for the V2, you're going to get the V2 for an even lower rate than I advertised. So that's the strategy. I know that there are people who said, I want to pass in 2024, and you've just been kind of hanging around. I want to make sure that you are able to get what you need. And if you already have V2, don't worry. I have some other things in store for you during Black Friday. Plus, we're having multiple game nights. And you know, during game nights, we pick a winner, cash prize also. So this is a great time during the holiday season, the studying season, to reward yourself for consistency. Because if you're in the know, knowledge is the new money. Knowledge is the new money. But the only way you will know what's happening is if you sign up for Black Friday here. V2 Remar is coming. Go to remarnurse.com/Black Friday. And honestly, I think, so the event, the book sale starts again on Friday. We have Quick Facts for NCLEX plus Quick Facts for Nursing School. Both of those books will be $10 only. And we're going to do that Friday through Monday. So because I know there will be a huge rush over the weekend, if you order your book on Friday, most likely it will either go out on Friday or it will go out on Monday. If you order your book on Monday, you're probably going to have to wait until all those orders on Friday and Saturday and Sunday to get cleared. So when it comes to Black Friday, trust me, it's always best to set an alarm and just do it and get it. Just do it early. Okay. So I'm positioning you guys for greatness. Sign up for it. I think we'll be starting our first game night next week, and we'll be going on from there. So I'm super excited about it, and I cannot wait to spend the holiday season with you guys. Black Friday's coming. Thanksgiving is coming. Then Christmas is coming, and we will be here for you all throughout the holiday season so that you stay focused on your goal, because the holidays are great, but passing NCLEX is greater. So remember, if nobody told you this on this Wednesday, you can, you will, and you must pass NCLEX. See you later. Bye-bye.